Is the pain better following the chemotherapy treatments?
Better now, but still not great.
He still has periods when he's in a lot of pain. And when the pain starts, he can't sleep. And when he doesn't sleep, he gets more confused as opposed to just forgetful. I'm not sure what's happening or what medications to give him.
Yes, I know that can be confusing. And how is the hip doing now?
It's okay, but I still get tired so quickly. Like today, I won't be able to do anything after this appointment.
What's your biggest worry?
There are so many things that seem to go wrong after the chemotherapy. If I could get more help understanding his medication...
Joe and Jane's doctor is about to suggest home-based palliative care to help assess Joe's symptoms, to provide education around the use of his medications, and to review Joe's goals and values with respect to his treatment.
And hopefully not have to come into the hospital quite as much.
The social worker on the team will also be able to support Jane and help her think about next steps depending on how Joe does with chemotherapy.
Palliative care is an interdisciplinary model of care with the primary focus of the patient and the family. So the goal of that care is to help the patient live as well as they can for as long as they can. Members of the team include physicians, nurse practitioners, social workers, chaplains, and many times volunteers. In the case of Jane and Joe, I think palliative care will be very useful in helping to support the primary care physician and assess Joe and Jane's understanding of the medications that they've received, some of the symptoms that Joe is going to be experiencing as he undergoes treatment, and really helping Jane figure out which medications are going to be most appropriate, depending on what she's seeing at home.
So I will talk to Dr. Wheeler and make recommendations, and we'll come up with a plan that will get you feeling better.
Okay, but if I have any questions, who do I call?
Well, if you have a question about the pain regimen that we come up with, you can certainly give me a call. But usually when someone starts on new meds or we adjust the meds, I'll come back out within a week or so of the change just to make sure everything is going okay and that you're satisfied with your level of symptom relief.
Other members of the team, like the social worker, will be able to support Jane as she's struggling with some of the transitions Joe is going to be going through over the next days to weeks or months.
You have a case manager at the health center, and I can get in touch with her, and she could provide you with information about community services. In addition to that, we have a social worker that works with us on our team, and she would be available to come out and meet with you, and it helps give you some support around these issues because I know you're going through a lot.
She'd come to the house?
Yes.
Oh, wow.
Yeah.
And she comes for both of us?
Yes, she comes for both of you, and because you're in this together.
Yeah, we've learned
The
that.
Institute of Medicine has called for broader access to palliative care across the continuum. The leadership at Mass General has recognized that the home setting is a huge gap in our continuity of palliative care services. Many patients are either homebound or have significant difficulty getting into our outpatient palliative care clinic, and those patients are often the most vulnerable patients and the patients who have probably the highest burden of palliative care needs outside of the hospital. The home-based palliative care program was therefore developed to help address those needs and to be able to deliver palliative care to that population so that we can deliver the right care at the right time and in the right place, increasing the quality of care we deliver to patients and therefore effectively reduce costs.